Assalamu alaikum. I am Dr. Faizullah Sulaiman. Euglycemic diabetic ketoacidosis is important topic. The patient presents to the emergency department with all signs and symptoms of DKA, and the patient is having high in iron gate metabolic acidosis with normal sugar level. So on this point, the clinicians and nurses' attention may be diverted towards the other causes of high in iron gate metabolic acidosis like lactic acidosis, uremic acidosis, aspirin toxicity, ethylene glycol, and methanol poisoning. So it is important to catch the diagnosis promptly and start the appropriate management. Euglycemic diabetic ketoacidosis is basically caused by sodium glucose cotransporter 2 inhibitor drugs. These are the drugs which are used for the treatment of type 2 diabetes mellitus. For example, canagliflozin, dapagliflozin, and empagliflozin. So on this point of view, from this point of view, the patient should be advised to stop this medication, and the patient will be counseled not to take these medication in future. There are some other causes of euglycemic diabetic ketoacidosis like injection of insulin just before arrival to the emergency department, pregnancy, and starvation. So the treatment of euglycemic diabetic ketoacidosis is different from the hyperglycemic diabetic ketoacidosis. The patient will be initiated low dose insulin, 0.05 international unit per kg per hour, and the 5% dextrose water or sometime 5% dextrose water with half saline will be initiated, and the treatment of low insulin and 5% dextrose water will be continued until the ketonemia is absent and the high in iron gap is closed. And the patient will be advised not to take these medication in future for the treatment of diabetes mellitus, and the patient will be advised to treat the sugar level in diabetes mellitus by taking other oral anti-hyperglycemic agent and or insulin. Because it is most likely when the patient suffered once by euglycemic diabetic ketoacidosis, there are chances that the patient might be suffered again by the same complication. So it is necessary to discontinue the treatment, and the patient will be managed as early as possible. Thank you.